What are the signs and symptoms of a nervous breakdown? Nervous breakdown and mental breakdown are dated terms describing emotional or physical stress that temporarily makes someone unable to function in day-to-day life. Though once used as a catch-all for a wide range of mental illnesses, the medical community no longer uses the term nervous breakdown to describe any specific medical condition. Nonetheless, a so-called nervous breakdown remains a sign of a recognized underlying mental health condition such as depression, anxiety, or post-traumatic stress disorder or PTSD. So the signs and symptoms of what some people may still call a nervous breakdown depend on the underlying medical condition. Facts on a nervous breakdown. The symptoms of a so-called nervous breakdown vary widely between individuals. Medically speaking, there is no such thing as a nervous breakdown. Treatment for a nervous or mental breakdown depends on the case. Signs and symptoms. Since it is not associated with any specific medical condition, a nervous or mental breakdown does not have any defined symptoms aside from difficulty or inability to function normally. What it takes for a person to be considered fully functioning differs between cultures, regions, and even families. However, common signs and symptoms of a nervous or mental breakdown are feeling anxious, depressed, tearful, or continuously irritable, feeling helpless, hopeless, and having low self-esteem, withdrawing or avoiding normal social situations, calling in sick to work for several days in a row or missing appointments, unregulated sleep schedule, either sleeping too much or not enough, unhealthy eating and hygiene, often due to people forgetting or not being motivated to eat or clean, difficulty focusing or remembering the events of the day, feeling continuously emotionally drained and physically exhausted, often without cause, lack of motivation and interest in things, being unable to get enjoyment or fulfillment from things that normally bring joy or satisfaction, unexplained general aches and pains, difficulty getting along with or tolerating other people, suicidal thoughts or thinking about harming oneself, a lack of interest in sex and menstrual changes, moving or speaking more slowly than normal, frightening flashbacks, severe nightmares, and fight or flight symptoms such as racing heartbeat, dry mouth, and sweating when there is no threat or danger. In extreme or untreated cases, especially when related to mental health conditions associated with psychosis, symptoms may also include hallucinations, paranoia, delusions, and lack of insight. Most people experience periods of extreme sadness, anxiety, and hopelessness from time to time, specifically after very stressful events. But when someone becomes unable to perform day-to-day tasks, withdraws from society, or begins to consider harming themselves, they need to have medical help. Management medications and therapies exist to help treat most of the medical conditions associated with nervous breakdowns.